Today I'm here to discuss the evolution of the AD landscape and how our approach to treatment has changed over time. The treatment of Alzheimer's disease has really changed amazingly over the past several decades. At first it was discovered early on that Alzheimer's disease is associated with changes in certain neurotransmitters in the brain, particularly acetylcholine, which is an important neurotransmitter distributed throughout the cortex and the various substructures of the brain, including the hippocampus. Also medications that seem to improve the functioning of neurons, the N-methyl D-aspartate antagonists, for example, seem to help neurons that are perhaps noisy or not functioning as well function a little bit better. So those two symptomatic medications made a little bit of difference along the way, but they didn't slow the disease down. More recently, that landscape, of course, has changed to treatments that target the beta amyloid protein, remove it, and that seem to slow down the progression of the disease. People on those treatments after about 18 months seem to be less progressed than patients who are on placebo. So I should emphasize that in the clinical trials, both patients on treatment and patients on placebo overall seem to both unfortunately worsen and progress over time, but people who are on treatment with the amyloid targeting monoclonal antibodies seem to progress at a mildly slower rate when looking at cognitive and functional measures than patients who were on the placebo. There are now clinical trials that are looking at other treatments in Alzheimer's disease that I hope will modify the treatment landscape further. So treatments are being looked at that target neuroinflammation, that target other neurotransmitter changes, that target changes in energy metabolism in the disease, and that target the hyperphosphorylated tau protein, which is more closely linked to the cognitive deficits and neurodegeneration. The availability of new treatment options, I think, has made a world of difference into how we're approaching the disease. Now that newer biomarkers and treatments are available, and also studies that look at lifestyle factors as well, it's become apparent that making an early diagnosis can make quite a number of differences to patients. I think healthcare systems are now moving towards trying to make that diagnosis earlier. But basically, the newer treatments and newer interventions suggest that it is important to make an early diagnosis, and we are educating our primary care colleagues in this as well, and educating the public at large about the importance of coming in. If you come into the doctor, the point isn't to take away your independence or take away your driving. We have to think more about what we're going to give back to patients, how that early diagnosis will allow them to make decisions to keep them more independent, allow them to treat the behavioral and other manifestations of the disease so that the earlier diagnosis leads to an improvement in their lives and is a giving back rather than a taking away.